So if you've watched me over the years, you've seen every hit I've taken on the field, in the pits, on TV, and today I'm doing something most men would never do. I'm laying it bare, almost literally. I had work done, a deep plane lift, and I did it for one reason, to stay sharp in an arena where the camera shows everything. And here's the truth. It's not just me. The Wall Street Journal is reporting tech bros are lining up for surgery to stay competitive. Men's Health says guys everywhere are quietly doing the exact same thing because pressure doesn't care about your pride. So I brought in the surgeon who sliced me a while back, Dr. Jacob Steiger, South Florida's celebrity go-to plastic surgeon, to talk about the new reality for men who want to keep their edge. This isn't cosmetic. This is strategy. If you're a man in the game, you'll want to stay for this one. All right, well, as promised, Doc, Dr. Jacob Steiger, Doc, why was that so hard for me to admit that I've had a procedure when I've been basically in a business where it requires you to look good, to look young, to be vibrant and competitive, but still, men, it was a very, very difficult thing for me to reveal this right now. Why?
Well, that's a good question. Everybody has their own internal kind of perceptions of what they look like, what they want to look like, what they expect to look like when they look in the mirror. And certainly men have gravitated towards plastic surgery and cosmetic surgery in troves in the past 10 years, and it's getting more and more popular. So the issue is a lot of men don't talk about it. I mean, you're brave, you come out, you talk about it, but in the media you see all these stars or commentators saying that this person had this plastic surgery. They don't look like themselves. They look terrible. We were talking about, before the show, you asked me, hey, what did this guy do? He doesn't look like himself.
Well, Bradley Cooper.
Yeah.
I mean, everyone's talking about it. Feel free not to talk about it if you don't want, because, by the way, he's a plastic surgeon, not just to people like me, to real stars and whatnot, and maybe you don't want to. But Bradley Cooper, it changed his look. I mean, it doesn't look like the same person. It took away what I would say a handsome look to his eyes. He looks scared or something. It's a different face.
So so allegedly, if someone did, I tend to not, as we spoke, comment about celebrity plastic surgery. I never have it. I won't for a variety of reasons. But there are certain parts of cosmetic surgery, the art. There's a technical nature to it. There's an art to it as well. And there are certain parts that just people have their identifying characters. So when you do cosmetic surgery, we think about this, or at least I think about this. I think of someone's perception, what makes someone them. Oftentimes people will bring me photos of themselves from 10, 20, 30 years ago, and you see there's certain defining characters. For example, people's eyes. We talk about bedroom eyes, and there's been certainly several celebrities through the years that have had plastic surgery, and it changes that a little bit. It can change it. And sometimes, it's funny, I've seen people comment about people that I've done surgery on in the news, through the years, and a plastic surgeon say, oh, they had this done and this done. Totally off. Like not even close what they're having done, at least, and these are people I have intimate knowledge of.
So you can pull up a picture and you can pretty much pick out what procedures people have had.
I don't think you can tell 100% sure, because unless you look at really standardized shot, you see all these people out there in the media, or the media will put a before and after picture, and you're looking at filtered shots after, or they get someone in a bad angle. They had that with Madonna years ago, and I've seen, they've seen that with the Kardashians recently, and you don't know what.
The Kardashians say they didn't have any surgery.
Well, I think
it's comical.
I think the Kardashians have, for the most part, come out. Mama
Okay.
Kardashian has come out, and they certainly have branded themselves as cosmetic surgery lovers.
Well, let's get to the dudes. I mean, really, this sparked, kind of sitting around, I get sent this article about tech bros who even their 30s, in their 40s, feel that to compete at the level for the gig, for the venture capital, for whatever it is they're looking for, are starting to move towards actual plastic surgery, not just Botox, actual cutting and nip and tucks to compete. One study said it's up 500% over the last 5 years, men having cosmetic.
I mean, for years, men constitute now about 25. I mean, my specialty is faces. I do eyes, face, neck, anything from the clavicles up. And so in the last 15 years or 18, 20 years, I've seen that the biggest growth segment in cosmetic surgery has been men. I mean, women have been doing it for a while. Women are continuing to do it. The
What's
boomers.
the mix now? What's that? Men to women. So here's why. The NFL is very proud to tell you about 42 or 43% of their audience is women.
Right.
20 years ago, it was maybe 15, 20%, right? So the women are moving into watching NFL. What percentage of yours or a high-level plastic surgeon, what's the mix, men to women?
So you'll be surprised by this number. It's actually 20 to 25%. And it's probably gone from 20 to 25 in my practice in the last, 5 years. Now, remember, the pie has grown. I mean, a lot more people are getting facelifts today. Facelift is a big thing today. And so that pie has grown. But and to still, not only the 20% of the amount of people, 20% of 5 years ago's number to 5 more percent in addition to that of today's number is a large amount. So on any given week, if I were to do 8 facelifts a week, 3 of them are men. There are weeks where I do all men. But it's interesting. You mentioned the article. I would say even 10, 15 years ago, it wasn't. There was always kind of certain guys that would like plastic surgery, but it wasn't who you would think would want a facelift. And usually it was CEOs. It was guys that were turning in their 50s or, getting to their 60s. They were still very active. They were doing deals. They're businessmen. They're on boards. And they just felt that people would look at them differently, whether it's true or not. Internally, they felt that way. And they would come to get the neck is a big deal. I've had very successful CEOs of huge companies that were now on TV or they're doing media tours and they have their collars on. They see the waddle. They want to get rid of that. So that's who I saw doing, or I see most commonly doing cosmetic surgery. Exactly what you said, like the tech bros from this article from the Wall Street Journal, where I think there's a quote in there that Peter Thiel once told.
Peter Thiel?
Yeah, that once told the gentleman in the article that if Keith.
Don't hire anyone over 30.
Don't hire anyone over 30. So here are these guys because they don't know what they're doing, right? Or they don't look. Here are guys that this is ingrained in them 20 years later. So there's like a whole neurocognitive aspect to the way we perceive each other. The way you look at somebody and you say, gosh, he must not know what he's doing, and this is imprinted in them because their colleagues, they think that's what they're thinking. They're looking at them. This is a young man's game.
What about recovery? Do men recover at the same pace and speed as women?
So, the good thing about, and this is strictly talking about facial surgery, men actually recover a little quicker than women. And it's not that they recover quicker, it's that men can pull off swelling more than women can. In the sense that when you're swollen after a facial procedure, gravity brings swelling down. So we have more fullness, you're more square. That's a masculine look. Women, it just looks odd. In men, it looks normal. A lot of men can grow a beard, facial hair. So a lot of guys will grow a beard after like a facelift, for example. They shave their beard,
It's literally the day I started growing this.
Oh, you did?
The last time I shaved all of it was the day before surgery. What are the new procedures? Like, has it evolved? Are men doing different things now that they didn't used to chin implant? Tell us what the new procedures are.
Well, the thing about cosmetic surgery, especially in the last 20 years, and coming to facial plastic surgery, facial cosmetic surgery, facelifts, the technology or the techniques at least, we've really now understand the aging process, what causes things to fall, what causes things to sag. So in the old days, and still done today, unfortunately, but it's just a pull, it's a tightening, right? Oh, we're going to tighten your muscle. So it started out in the 60s and 70s. Plastic surgery, talk about taboo. I mean, very famous surgeons from Johns Hopkins would do, on the weekends, they had these private clinics and very hush-hush, they would do plastic surgery on their wives' friends, and they would tighten faces. And the technology was new kinds of stitching material. How can we make it tighter and tighter? And that whole windswept look of the 70s came about. Then in the mid to late 70s, surgeons started saying, okay, we're going to tighten the deeper structures, right? We're going to tighten the muscle layer of the face. And they started doing that to give more structure, more
deep plane. Is that what the deep?
Well, not deep plane. Yeah, this is the SMAS layer, which is a layer that is right beneath the skin that wraps your whole face. And when doctors pulled or tightened that layer, they were able to achieve better results. Sometimes it looked done, sometimes it didn't, but it was better than what they had before. Now, you mentioned deplane, and what we've really learned in the past 20 years or so is that what causes our face to sag, we use the word gravity, but it's not gravity, there's ligaments in our face, like our shoulders, like our elbows, like our knees. The ligaments that hold up our face, they start to sag. So what we're doing today is we're targeting these ligaments. We're fixing the problem at the root of the problem, at the
The
ligament level.
elasticity is falling out of the ligament?
Yeah, ligaments get looser, they get more elastic, they lengthen. So what we're doing is we're going deeper into the muscle layer, finding the ligaments themselves, releasing the ligament, and restoring it back to where it belongs. So you're fixing the problem at the source. Like anything, you want to find what the problem is and break it down into that and bring things back to where they should be or where they belong. Now, there are things we can't fix, and when you try to get misadventurous and you try to go overboard, then you see what happens, and we talked about that. But I think as long as the hardest part of my day is telling people no. You see these people in front of you, very successful people, and they I'm willing to do anything I'll pay anything. I'm like, listen, this is and you don't know, or people don't know what's on the other side of it. Okay, they think they want something, but they don't want that. Okay, so that's my job, kind of to.
Is it?
Yeah,
Is
for
it?
sure. I'm not just a technician. I like to be. I'm a consultant. I'm your consigliere.
Well, if someone says, look, I know the risk. I know you probably don't think I should do this, but you're good. Now, I want you to do it. You won't do it?
It depends. I mean, if it's because they think they're going to achieve something. So the answer is no, I won't do it. I used to do it. And then the problem is if they then come to me 6 months later, a year later, and they say, I don't like this, doc. And I can't say, I don't agree with you. I mean, I agree with them. I don't like it either, but I did it because they told me to. But
Right.
but I still, then it's my problem. I'm not the kind of guy that said that's not my problem. I try to help people, and I've been there. I've done that, and it's not in my.
Is there something a man should never do because it's different from women's procedures?
Not necessarily. It depends on the person. It depends on their structure. It depends, on how they look. I mean, certain things, like we talked earlier, certain people have defining characteristics, like lifting eyebrows. Lifting eyebrows, for the most part, I lift eyebrows with, eyebrow lifts, 25% of my procedures. I'm sorry, within 20.
But just so folks understand, when you lift eyebrows, you're cutting into your scalp.
Yeah, there's a few different ways to do it, but the most common way, we make little cuts up here, access points, and today we can use cameras, like endoscopic cameras are called, and we use that to release the tissue, and we're basically lifting the eyebrows, either back to where they belong or to a position they've never been in. In my view, it's always been my view that very few people actually need brow lifts to make them look younger. So there's two kinds of surgeries, right? There's rejuvenation surgery, which you look like you, just more youthful, and there's augmentation. You're changing the way you look. For the most part, lifting eyebrows in a 40 or 50-year-old is changing the way you look. But people say, listen, I always had low brows. I never liked my low brows. We do this in men and women, and I always wanted them higher. And it might look better on those people higher, but doesn't mean it's for everybody. And that's when you start getting into, okay, this guy looks different. This guy has changed the way he looks. This is not their identity anymore. And, certainly you talked about celebrities and that, and they have an identity for a reason. There's those imperfections in the way in their face makes them who they are. So you change that, you have to be really careful about that. So that's where I would get into the point where, no, I'm not doing this. And I put my foot down every day. I'm like, this is not for you. Don't do it. Go somewhere else if you want to. They don't. They never go anywhere else. But
So I've said the pickleball craze is God's gift to orthopedic surgeons.
Right.
I think Ozempic may be God's gift to plastic surgeons. The fast weight loss tends to make your skin. It doesn't allow your muscles. You lose muscle mass as well, right? So tell us about Ozempic, and are you seeing more patients because of Ozempic?
Oh yeah, I mean, like literally every day. The Ozempic craze, that brings in another element. We talked about ligaments falling. The other thing with weight loss, especially the large amounts of weight loss, people are losing 50, 70, 100 pounds. You get an expansion. The balloon is blown up. Right? At a certain age, 30, 40-year-old loses that weight. When the balloon deflates, the skin will come with it. You get to the age in the mid to late 40s, 50s, that balloon is not going to, that extra skin is just going to bunch up. And so it's amazing how much skin we're seeing in patients with Ozempic face, what they call the GLP-1s. Now,
what do you do for Ozempic face? Because you're losing structure. muscle structure in your face, right?
Right.
So what is it?
So it's basically like an expansion. Things are blown up, right? Everything is stretched out, and then it's brought, from years of being fuller, and then all of a sudden, in a very rapid, time, it's just coming down.
So is this rejuvenation or restructuring?
It's really it's both. It's really rejuvenation. I mean, they want to look younger, but we tend to take out large amount of skins. Now there is, I could tell you from anecdotally, is when I do patients on GLP-1s or who have been on GLP-1s and have lost a lot of weight, the skin has a different quality to it as well. It's just stretchier. It's more doughy, for lack of a better term. So we tend to remove a lot of skin. Now, even though we're doing a deep plane facelift and we're focusing on the ligaments, a lot of skin still comes out, but it's not pulled or stretched or tightened. And that's an important aspect, because what makes scars look thick or wide is that when the skin is tension is on it, so it doesn't heal well. Your body is fighting the forces of the tension on the skin, so it ends up forming thicker scars. When you don't have tension on the skin and you're focusing on the deep tissues of the face, it's a lot, the healing is just a lot better. So even though, and I don't put tension on my incisions at all, that's the beauty of doing a proper deep plane facelift. But in these patients, we're seeing, 2-3 inches of skin on each side being taken out.
Wow.
Inches, not centimeters.
What if they stop the GLP and they pick the weight back up?
So that's a good question. They'll fill out. You'll definitely fill out depending if you gain, if you're going to gain that much weight back, you'll just fill it out.
Your skin will be able to handle it. You look like a stretched balloon, overblown balloon.
I think if you gain the weight, you'll basically when the balloon is deflated, you'll see all the stretch marks. If you inflate it back up, I think that'll just.
But if you've cut 3 inches off each side,
you mean after?
You have the surgery,
okay.
You gain the weight back.
Oh no, if
you look like a pumpkin head.
If you gain the weight back, that's happened. Actually, I always tell patients, that's a good point. Whenever someone comes in with weight loss, or they're on GLP-1s, or they're doing things naturally, and they want to lose weight, I always ask them how much weight they plan on losing more. If you're losing more than, call it 5% of your body weight, so if you're 200 pounds and you're going to lose, 10 more pounds, lose it before surgery. Because if I did a facelift on you and then you lost 20, 30 pounds, you'll still look great and you'll look better than you looked before, but you're going to want a little bit more. If you lose all the weight, I do your surgery, and let's say you gain 5-10 pounds, you'll look fine. You'll look great, actually. Because, there are studies. And this, like I said, it comes back to the whole neurocognitive aspect of how we evaluate people, when you look around and you look at people, you meet somebody, and what your perception of them is, deep inside. There was a study done on identical twins. I believe it was in Cleveland. They were identical twins, and a surgeon basically found a bunch of pictures of identical twins. I don't remember how many, and they standardized, they found their weights, and they showed these pictures to medical students. And they asked the medical students to identify which twin is younger and which is older. And bar none, the heavier twin was the younger twin.
Yeah, well, there's no question when you lose weight fast on GLPs,
right.
You're aged.
But in general, when you are heavier and your face is fuller, you look younger.
Yeah.
Now this study was like 20 years ago, and that was when a lot of people were doing a lot of fat injections in people's face, and they were filling people's face, and that got a little ridiculous. That pendulum
does that get in the way if you're doing some dude's facelift and he's been injected with filler? That's
a great question, and that's something that's very, very big. Men are injecting fillers just as much as women these days, and the answer to that question is, does it affect me? Yes. Is it a deal breaker? Absolutely not. Like a lot of my colleagues will say they can't do a facelift if you have fillers in your face. I would probably lose 80% of my business if that was the case.
80. There's that many people doing filler.
Yeah, absolutely.
And the filler lasts a long time.
Filler lasts a lot longer than the label says. It lasts a lot longer in your face than you see. The clinical effects of it kind of go away quicker than actually the filler
Can you
resolve.
Get the same result with Botox, or was it Daxify? Is
Yeah.
It's called? Or
Yeah.
Longer
lasting.
Longer lasting. But can you get a similar facelift look with enough of that?
Absolutely not. So again, it all comes down to, you got to treat the problem, right? When you try to do, so again, we talked about full faces, right? So men, women, they're injecting stuff in their face to get rid of folds, volumize their face. But again, that doesn't fix hanging. When you try to fill your face to compensate for hanging, you're going to look like a
I'll just tell you, folks, we're leaning into this because this is what the edge is. Find your edge. The whole idea of this show, which we're growing insane, top 1/10 of 1% of all new YouTube shows 125 times faster than all new YouTube shows, because it has to be part of it. You can work out and you can look good, but if you don't physically look good, it's your calling card, right?
Right.
You may not have a competitive edge. There's an Australian study that just came out that said men who had facial reconstruction, whether it's rejuvenation or reconstruction, they didn't tell us how much of it. Men who have had that are higher paid, they have higher net worths, are more successful, more incidences of upper level management. I mean, is it a fluke?
I mean, unfortunately, that's the world we live in, right? I mean, that's certain actresses, certain models. I mean, they look a certain way. Male models, male actors, they look a certain way. Brad Pitt is Brad Pitt for a reason, right? I mean, he's an amazing actor. I would say very talented actor, but he's a very good-looking man as well. So he fits a certain stereotype in people's heads. Same thing with in any industry. That's something that we see time and time again. Not just in the 21st century. This is going back to the days of Cleopatra. The days of Cleopatra, there's documented aesthetic procedures being done, peels and all kinds of stuff that was done back then. This is as long as we're human, as long as we have a frontal lobe and a prefrontal cortex and an amygdala, there's an emotional aspect to how we look that whether you want to or not, people perceive you a certain way. You can say it's sad, you could say it's a good thing or bad thing, but it is what it is, and we're all affected by it.
Tell us about the expense of it. Now, I know every doctor has its own chart, you have your own price list for different procedures, but is it generally going up, going down? Give us a kind of a range of not the guy in the corner, but a good plastic surgeon.
I mean, that's an interesting topic. It just depends. I mean, it depends what you're doing. I mean, the Botox and the fillers, those non-surgical kind of stuff that help men look, better. And like you mentioned, Botox, the wrinkles, that stuff is, $1,000, a few $1,000s, something that you have to keep doing.
How often?
It depends. Yeah, Botox every 3 to 5 months, fillers maybe once or twice a year, depending on what the effects. We always say build it. Don't just go all in right away. Build it slowly. It's a better way to do it. And then you're talking about facelifts. You're looking at $50,000 up, for a facelift, and that's including operating room fees. This is done in a accredited surgical center with anesthesia. Very, very safe stuff. I just came back from doing 2 facelifts today, and
either one men.
One was a man, actually. One was a man. One was a woman. Tomorrow, I have a man and his girl and his, I think now wife, very very successful entrepreneur, who is
Age, how old?
I believe he's in his early 60s.
Okay, is that the? When did they start?
Actually, I just saw a man who's the man today was early 50s.
Early 50s.
Yeah, and he was super busy with his career for a long time. Didn't even have time to get married and or have kids. Now he's kind of this other end of the spectrum. He's trying. It's not necessarily to be business competitive.
No, he wants to be the girl.
He wants. Yeah. And I told him. I said, listen. I go. This surgery is not for you to get a girl. It's not gonna. That's not what's doing it. But it's you when you feel better about yourself. The way you feel. It's not just how other people perceive you. It's how you perceive other people perceiving you. It changes everything. It changes your confidence levels. And like I said, I see it time and time again. Men are some of the best patients because they're pretty quiet about it. They're for the most part very, very happy with their plastic surgery. I mean, the neck is the biggest thing for a man. I mean, it just bothers them to no end. And the first surgery men generally do in aesthetics is their eyes. That is a very common thing done. It's very easy. We jokingly say in our office that's the gateway drug to plastic surgery.
Gateway. Not Botox or that. Eyes are your gateway.
I feel like eye is the gateway to surgery. I mean, certainly, the intro to aesthetics is usually Botox. It's relatively inexpensive. It's quick. It's easy. It works right away. And it's like that gets people hooked. But then as far as surgical procedures, eyelid surgery, I could do an eyelid surgery on a guy. In 10 days, he's back to full activities and work and everything. Barely noticeable. I mean,
want a dirty little secret, folks? Doc did I did a deep plane facelift. I was back on air on the 8th day.
Right.
That was aggressive. I'm sure a lot of people noticed something was up, but of course I said, "Oh no, that was I had the laser peel." I said, "Oh yeah, the swelling's from the laser peel."
That was definitely
coming clean, guys, for the edge. Coming clean there.
That was on the aggressive side of things. I remember my office was saying they were all, he thinks he's going back in 8 days. I said, Eric's his own guy. I can't strong arm him into anything. But yeah, I mean, if you felt comfortable, and that's fine. So it's all about. It's how you feel and how we feel. And yeah, can you go back at 8 days from a facelift? That's aggressive for sure. Eyelid surgery
on TV,
no problem. I know. I remember. So. But yeah, so the eyes are generally the first thing, and there's no pain. It's easy. It's quick. It's kind of like a no-brainer. So that's where most guys start out, and for the most part with surgery, but the neck is a thing that men are the most like. When you do a guy's neck and his neck just looks better, they put the collar on, and they don't have that little turkey like gobble hanging out there, and it changes things a lot. It makes them happy. They feel more. And that, like I said, it's not just about other people's perception of you. It's how you perceive yourself. Like the tech bro, I'm sure he has it. Like we said, it's imprinted in his head. Someone said, if you're under 30, you can't get a job in the tech industry. Now this guy's 50, he's got tons of money. But he doesn't. But he's like, oh crap! Nobody's want to hang out with me anymore. Nobody's want to do business with me because I have this. Whether that's true or not, it's how he feels, and you fix that, and it changes things.
Who uses the secret back door down the stairwell to not have to walk through the waiting room more, men or women?
It's actually, certain men, we have to schedule certain times for them to come in when nobody's in the office. But for the most part, the secret back door is utilized very commonly. A lot of people that come to my office, they say, well, should I go out the back door because I don't want people to be scared? I said, there's nothing to be scared about. Let people see you. That people are here for this. We're not hiding anything. There's no mischievous thing going on here. People should see how you look right after surgery. And if anything, it'll make them not scared. It's not that bad. It really isn't. The technology today, how we do the surgery, the way we do anesthesia, it's so advanced as over 10 years ago. I remember when I was a resident, I trained up at University of Pennsylvania, and I remember the main aesthetic surgeon there. We were this is before I was in plastic, part of it. I would see some of his patients right after surgery, and I even thought to myself, who would do that to themselves, right? It is nothing.
This is a very fascinating angle here. Would you? I mean, is there a point where you go, I'm going to have someone, and why? There are a lot of plastic surgeons who I look at and like, wow, that dude really needs to have some surgery on himself. And I'm thinking, it's your calling cards, right? Tell me, what's the mentality?
So I would do it, but again, this is our problem as surgeons is a trust issue, right? Who are we going to trust to do it? Surgeons think we all think we're the best ones, right? So I'm the best surgeon. Who's going to do a good job, on my face? So the answer is yes. I want to do my eyes. I want to do my lower eyes specifically. I got little bags. I've had them since I'm 30 years old. If I did my eyes, I'd be back to work 3 days later. I wouldn't even think twice about it. Lower eyes especially. I do it from the inside, no scars. And so it's just about who do I trust to do my eyes. Plus, it's my eyes, right? So who do I trust for that? That's the major. But would I do plastic surgery in my eyes? 100%. I wouldn't even think twice.
Influencer plastic surgeons are exploding everywhere. They got millions of followers, and I'm not sure they're that good. Tell us what's going on with that world.
Okay, well that's an interesting. I just had in my office a very famous skin YouTuber who I did surgery on his wife, and we were talking about this. Basically, a lot of these big YouTube, or Instagram or social media plastic surgeons, I mean, they spend a lot of time on it, and it's great in the sense it's brought a lot
on the social media rather
platform.
than in the surgical, in the operating room.
100%. It's a full-time job. Like we have a presence on social media. I don't manage all of it. Every now and then I'll step in and do something, and it's good when I do it. And sometimes I look at things and I'm like, well, it could be a little bit better. It could be a lot better, but I don't have the time to do it. I mean, to make good content, it's a full-time job. So the answer is it's like self-proclaimed experts, right? So these are not people that are big in our field, our industry, in the sense of in a traditional sense of they're so busy or the best surgeon, but they have this perceived notoriety because they're so out there. But you're putting your whole life out there on social media. I want to do a good job. I want to do the best job possible on my patients. And the only way to do that is to do a lot of surgery. I've done thousands of facelifts, thousands. Doing 6 to 8 facelifts a week. I mean, it's a full-time job and a half. I have a family too.
Are you getting better as you go?
I mean, you get better. You can see. I would say it's called seeing around corners, right? So you can see this is gonna. You can deal with it. I always felt I deal with everything well, but now I can see something before. I can see something that, like, okay, in this person, this is so. Let's do this differently, so it'll heal quicker, it'll heal better, or it'll look better. And so. So the answer is yes. Like anything, the 10,000 hour rule. With experience, you just get better and better and more innovative. Like
there's a guy in New York, and I don't know if I might say his name. I'm not sure. He is a social media plastic surgeon. Everyone says he's the best in New York. He charges $250,000 for a procedure that you might charge 40 or 50, whatever it is. He's had some problems. He's had some drug problems. He doesn't look good himself. How are these guys, these New York plastic surgeons? And I can think of 2 or 3 that are anywhere between $150,000 and $250,000 for the same procedure. What are they that good? What makes them?
I mean, it's a vibe. It's like a New York market, right? Like, oh, he charged a lot, or he's on Park Avenue, so he must be the best. I mean, it's that. I think there's a lot of marketing to that. Personally, I think. There are guys that are great that charge less. There are guys that are terrible that charge a lot, and maybe you feel you got the $20,000 mace or belt or $100,000 bag, and that makes it a better bag. But that's not necessarily always the case. It's definitely not the case. And like you said, people can have problems. I think you see this in California too. Sometimes fame gets to people, and you're in the industry, so that fame gets to your head, and you can go down a dark path. And that happens. Surgeons are just as, actually, I would say we would be less able to cope with it because we're not used to being famous, right? In the sense of everybody always wants to know you or wants to be on your Instagram or be on your social media because because you do great work, or you do facelifts, or you did a celebrity that came out and said that they did your that you did their plastic surgery. But for me, I never wanted to be famous. That's not my in the sense of I don't need everybody to know who I am or know my name. My goal is I just want to do the best job possible. I want people to look awesome after I do surgery. I know that when I do a procedure, nobody can do a better job than me anywhere in the world in what I do. And if I felt that they did, gosh, I'd work a lot harder. I would, to
be the best,
to make that not.
There's your. Where'd you get that drive?
That's I talk to my kids a lot about this. It's you got to be determined. When I was young, I think we're all influenced by our lives, good things and bad things, and I would argue to say bad things influence us more than good things that happen to us. I was always a good student. I was always things came very easy to me. I never really studied. I always got straight A's. Things came to me, but other things didn't. I had to work hard at sports, right? I was a great tennis player, but it wasn't easy. And so I played tennis. I loved tennis when I was a kid. I played every day of my life. I didn't do any other sport but play tennis. I dedicated myself to it but then I remember having a good friend of mine who was just the most athletic guy I knew. He came and played tennis after I was playing for 5 years. He comes 2 months. He's like playing tournaments with me, and he's getting to the finals of these tournaments with me. But meanwhile, and that came easy to him. But I grinded, and so that grind and that desire to just be the best, I think came from. That's one of the things that kind of, like you said, that's
where did. Yes, I think there's a common theme. I ask everyone that sits in the seat, where did it come from? And they're variations of the same. I grew up, and a lot was my father. A lot of it, because this is this is men, pro bro show. It's incredible how many men say, I got the drive from my father. I respected my father, or my father. I wanted to prove something to my father. Whatever it is, where would you have one of those?
My father worked hard. My father was, came to this country, and he didn't, they didn't have food. They didn't come from. He had to make it on his own, and so my dad worked hard. Like I saw my dad leave the house at 7 in the morning, come back at 6, 7 o'clock at night. We saw him he made sure he came for dinner every night, and then on Saturdays he'd work every Saturday. So I saw him work really hard, and I saw him struggle. My dad was a mechanic, car mechanic, and I saw him do that. And I remember one day I used to go to the garage on Saturdays because that's how I get to see my dad. I'd be at the garage. I would help him fix. I used to rebuild alternators and starters, so I used to help him do that or do oil changes. And one day somebody came and asked me and said to me, "Hey, what do you want to be when you grow up?" I was like 9, I think 8, and I said, "Oh, I want to be a mechanic like my father." He heard that, never let me come to work again. He said, "My hands are black and dirty, so yours never have to be." Yeah. So I was always into like very engineering kind of like brain. And so one day, I looked into medicine, and I was really into surgery. I wanted to be a surgeon. I knew I wanted to be a surgeon. And so I went up to my father. I said, "Can I be a surgeon? Is that okay?" And he goes, "Yeah, that's good."
That's a good one.
That's kind of the start. And then, I was always very into art and sculpture, and I never actually put the two together until much later.
Very interesting here. Do you need to have that side of your brain? What is it, though? I guess it would be the left side of your brain, which it's all about creativity and seeing beauty in art and being able to do that on someone's face, as opposed to the right side of your brain, which is just doing the calculations on how much you're going to bleed, how much you're going to scar.
Right. That's a good question. And the answer is you can't be too left-brained, you can't be too right-brained. You have to know when to lean on either side. So yes, you need to have an artistic sense. You can't, it's not just you could read I guess that's a difference between surgeons too, is like who's got the artistic sense and who doesn't. But then there's another difference, and that's the right side of the brain. Who understands the healing? Who's had the experience of knowing this is how you're going to heal, or this is the technical knowledge of how to do it. I mean, I'm doing the procedures I do today, I never learned, right? I have, we stand on the shoulders of giants. The guys who taught me and gals who taught me are amazing. They're like the amazing surgeons, but I would balk at myself if I did surgery the way I learned to do it 20, 25 years ago, like the technical nature of it. Today, what I do, if my 20-year-ago self saw myself in the operating room today, I'd be like, wow, that is unreal. And so this is a lot of innovation that goes into it, and it's baby steps, like, okay, tweaking this to the procedure over 20 years. Today, I do things totally differently. For example, some men, have big glands in their neck, so we got to take the glands out of the neck, the salivary glands. We got to reduce the size of them. That is a relative.
I read in that article. In the Wall Street Journal, that's they never used to do that, and now it's part of defining a jawline is removing the salivary gland. There's portions of it.
But yeah, we removed part of the salivary gland. That's something done. One of the surgeries I did today, we took out the salivary gland on the gentleman, and that's something that in the past 4 to 5 years it's new. So we did this in surgery when we did cancer surgery. You make a big cut here and take the gland out. You're not doing that this way. We're doing it through a small little incision underneath your chin. You're working with special instruments around corners, and you got to do this very safely. And so that to discover that, I didn't go watch or learn someone do that. This is something we've kind of innovated on.
Poor guys. Poor the air guys.
No, there's no.
Wait, I have to do this. I know we've been going long. This is fascinating discussion with Dr. Jacob Steiger, premier South Florida plastic surgeon, who's done many celebrity faces. We are not allowed to talk about who they are unless you want to. You invited me to one of your birthday parties once, and you also fly airplanes, and you have such a fascinating. Just very quickly, just tell us about some of the things that your success has brought to you.
Well, I'm always looking to learn. I love to learn. That's like, I read a book a week. I try to read at least a book a week. I'm always looking to learn. And a few years ago, I started flying airplanes. We've talked about that. And I started off. I never was a kid who said, "Oh, I wish I could be a pilot one day." But I have actually a patient of mine who was very into airplanes. He said, "Let me take you on a flight," and he took me on a flight. I said, "That's pretty cool. I think I could do this." And I started taking lessons, and I was kind of into it. I was like, maybe I won't finish this. But that's not my personality. Like, if I start something, I finish it. And so I started flying. And as I did more and more, and I learned more and more, I realized what there is to it and wanted to learn more of the nuances, I got pretty into flying. And I have about 400 hours in an airplane now. I fly quite a bit. I fly every week. It's one of those things you don't do haphazardly.
You're instrument rated.
I'm instrument rated. I'm
solo.
Getting my commercial. I mean, we live in South Florida, so we have the Bahamas in our backyard here. I love fishing, and one thing I'm short on is time. So going to the Bahamas, we go boating into the Bahamas, and could take you. I mean, it's a week effort. I could fly to the Bahamas, charter a boat, get a bunch of tuna, and come back and the next day. And it's been quite the journey, and it's opened up a lot of doors for my family, especially. I wouldn't even fly my family until I had about my instrument rating, and then on top of that, I waited. And I remember every time I flew with a lot of instructors, a lot of very seasoned pilots. Say, hey, do you think I'm good enough to fly my family? In fact, this is a funny one. My first passenger ever on an airplane, when I got and looking back at that, I was like, wow, I can't believe he came with me, was a Delta pilot. I did his wife's facelift, and he was in town. We were talking about flying. He goes, oh, I'd love to fly with you some. I go, you want to go flying this weekend? I just got my license.
So it's a good one. If something's going to go wrong, I got a Delta pilot.
He goes, I'll go with you. So, we went for a little flight, went for breakfast somewhere, and when on the flight back, he goes to me, when we landed, he said, I'd let you fly my family. You're a good pilot. So I said, well, thank you for saying that. I don't think so yet, but I knew I was a safe pilot. But so that, that's just a desire to learn, and now I'm getting my commercial pilot's rating. Just not that I'm going to be a commercial pilot, just because I think I'm never happy just being basic, right? I always want to look for more. What could be better? I remember when we were, just going back to cosmetic surgery for a second, when we were fellows, after my residency, I did a fellowship. I went to University of Michigan specifically to do aesthetic surgery of the face. I went to work with a very well-known guy, very talented guy in that specialty, and I was with him for a year. It's like I was his right-hand person. And
he's still alive?
He's retired now. He's hiking.
Because he wouldn't be the one to do your eyes if you
he's hiking. I would in a heartbeat. He could do my eyes. Yeah, he's hiking the world right now. Maybe I should go. That's a good point. Maybe I'll give him a call.
Take him out of retirement.
Come out of retirement. Just come.
One more to put the cleats back on. One more game.
Let's give it one more whirl for old time's sake. Yeah. So when I was there, I remember talking to a buddy of mine who was doing a similar thing at a different university, and I said to him, I kept saying, well, maybe we need. And this is before D-plane was a thing. This is in 2006. I said to him, maybe we need to start releasing the ligaments. He goes, Steiger, why are you always looking to reinvent the wheel? Why do you got to do things differently? I said, because there's got to be a better way. There's got to be something that works better. So whether it's, now, you hone your skill.
And this ended up being something.
A D-plane, yeah. D-plane was done. There weren't many of us doing it back then. It was very.
By releasing the ligaments.
Yeah, by cutting the ligaments, and at first we weren't doing full releases of ligaments. The first 5, 10. You're doing partially. I mean, you're working around the nerves of the face. You're working on the facial structures. It's extremely delicate, and so as time went on, we got more and more experience, and I started. Now every D-plane, I fully release every ligament and bring it. All the ligaments and bring them back to where they belong. But at first it was partial. So that's a difference that going back, the difference between surgeons is how much release are they doing. In addition, that's the right side of the brain, the technical nature, and the left side of the brain is
how's it going to look?
Yeah, what vector you're going to put. The vector of lift, and you want to. We think about people age in different different vectors for the most part, and people's volume loss is different. So how do we volumetrically reposition the cheek fat, or do we address the buccal fat? Do we resuspend it? Do we have to remove buccal fat? Do we have to release certain other like mandibular ligaments? Do we put a chin implant in? I mean,
do men do the buccal fat removal?
Men, yeah, we do buccal fat removal on men, but generally, like going back to saying yes or no, is I always want to look at their father or mother, their pictures of them to see how they look, and it depends on their age, because as we get older, men in their 30s or 20s, 30s, they feel they're too full, and women as well, but especially men. So I just saw a man yesterday in follow-up for this, and I took out his buccal fat, just that, a young guy who was early 30s, and
really?
Yeah, so I said to him,
guys in his 30 gets the buccal fat to give him a more slim,
a more chiseled look. Yeah, you could look cherubian, you look like a little baby, look more baby face. So sometimes I tell him, I said the sad strategy is if you're not the right candidate now, you're gonna pay me today to take it out. In 10 years, you're gonna pay me to put it back in.
Can
right?
you?
Yeah, you could inject fat in people's faces. Sure, you can.
But it's not. It's synthetic then.
Well, you can use your own fat, or we can use things that we have a lot of great products today, like biostimulators we can inject that stimulate your own collagen production. In fact, never the same.
We could do this for hours. This is just fascinating. No one's doing this. Listen, this is what the Edge is all about, man. And I can't wait to hear from the folks afterwards. Listen, laid all the cards out for you. And by the way, look. This is where we are. This is when we showed you this like a month ago or so. Everyone's talking about men are doing more things to look good and feel better about themselves. Dr. Jacob Steiger, premier plastic surgeon, South Florida. Thank you very much. And by the way, my surgeon as well. Thank you so much.
Thanks for having me, Eric. I appreciate it.
Look, most men hide this stuff. I didn't, because the Edge isn't about pretending. It's about competing. You just heard the truth about what it takes to stay sharp in a world that never stops judging you on screens, in boardrooms, in every room you walk into. If this episode hit you, if it made you rethink what staying in the game really means, then do me one simple favor. Hit subscribe. Hit the button right there. Join the mission and help me push this thing even further. I put it all on the line today. Face, pride, everything. If you're riding with me, show it. Welcome to the Edge.